Hi, my name is Ruth Noel, and I work at the Baylor Scott & White Outpatient Dialysis Center in Temple, Texas. It is one of the largest dialysis clinics in Central Texas and takes patients with high acuities that are not accepted by private for-profit dialysis clinics. All dialysis patients suffer from anemia to varying degrees, which makes this topic very important. The Quality Improvement Initiative of Anemia Management tracks the clinic's performance by monitoring lab levels for hemoglobin and transferrin saturation monthly, and by adjusting medications according to established protocols and lab results to keep performance within the national average or better. According to the Renal Network, CQI is required to create an accountable means for providing acceptable levels of dialysis to end-stage renal disease patients, and to provide comprehensive data that will be used in both assessment of outcomes and initiation of quality improvement programs. It is important for providing quality care that improves patient outcomes and to increase facility reimbursement as well. The facility trending lab values are evaluated during the monthly quality improvement meetings and compared to the requirements set by the Centers of Medicare and Medicaid and the ESRD network. The goal for anemia management in the dialysis clinic is to improve patient outcomes by closely monitoring lab values for hemoglobin and transferrin saturation. By monitoring these lab values, interventions can be ordered and implemented early to improve quality of life and overall health and well-being for our dialysis patients. Maintaining adequate hemoglobin levels reduces hospitalizations and the need for blood transfusions. Per ESRD network guidelines, management of anemia in chronic kidney disease usually involves repeated administration of epoetin, and this is done to achieve and maintain the desired hemoglobin value between 10 to 12 milligrams per deciliter. One of the goals is to have less than 5% of the overall patient population with a hemoglobin greater than 12 while on Epogen. For the Temple Dialysis Clinic, last month's rate was 5.2%. Another goal is to have the transferrin saturation levels greater than or equal to 20 in 90% of patients. Our clinic had a 70% rating. By making adjustments to medication doses, lab values can be improved. The quality improvement representative and the nurse manager print lab results for all clinic patients. The software system used by our clinic can generate reports for specific data. Every month, a PowerPoint is prepared with this data for our quality improvement meetings. This can be compared to the previous month's data, and long-term data for each patient can also be accessed through the system. Nurses supervise patient care technicians in collecting labs. They collect labs themselves, and they also ensure proper procedures followed in drawing and processing labs. They ensure all labs are properly labeled and spun if needed, and receive and forward critical lab results that require immediate action, such as blood transfusions for hemoglobin levels below 7, and nurses also inform and collaborate with physicians to make changes to medication doses for Epogen and Venofer as needed. Collaboration and communication with staff in the processing lab, physicians, patient care technicians, and clerical staff who enter lab orders into the system and inform nurses of any missed labs is very important. Some of the challenges that my facility faces in meeting anemia management goals are missed lab draws, deviation from the anemia management protocols causing lack of uniformity due to the nephrologist's differing positions on practice, labs that are not processed or handled correctly, and patients refusing medications. Nurses can help overcome these challenges by supervising lab draws and reminding patient care technicians of labs that are due that day. They can notify physicians when patients refuse their Venofer or Epogen so they can be educated by their physicians on the importance of these medications. They can let physicians know when lab results are unsatisfactory and medication doses need to be adjusted, perhaps out of protocol. Nurses should report any bleeding events the patient mentions, since this can significantly lower hemoglobin levels rapidly. In the proper monitoring of patients' anemia status, nurses are often in the front line. In order to make changes to the current anemia management program, the director of the clinic, the head nephrologist, the director of nursing, and the nurse manager would need to be involved. The lab can notify the clinic promptly of labs they are unable to process so that they can be redrawn during the next treatment. The lab courier can make sure that before taking labs from the facility, they are labeled appropriately and are good to be processed. Other departments should be notified of the clinic's desire to make changes to the anemia management process and what the clinic hopes to accomplish with these changes. Once the department heads have been notified of how they can help with the quality improvement initiative, they can assist with forming an action plan for their own department and implementing it with their staff. A quality improvement meeting with all involved departments would be the ideal goal. Improving anemia management will improve patient outcomes and increase the facility's reimbursement through the Centers of Medicare and Medicaid. This increase in funds will have a positive impact on the facility, since we are a nonprofit organization, and reinvest back most of our funding into the facility staff and patients. Our facility has funding for anemia management included in the operating budget, and manpower, lab supplies, and medications are part of the Medicare and Medicaid reimbursement bundles for dialysis. The timeline for any quality improvement project would be 1 month, which is the time between hemoglobin redraws. For iron and transferrin saturation levels, it would be 4 months, since they are drawn quarterly. Implementation would be done the week before the labs are done using the new protocols. By improving this process, we can not only help our patients live better lives, but we can also improve our facility's operating procedures. Thank you.